Okay, if we could welcome our next speaker, Sheni Ravji-Smith. Thanks very much.
Afternoon, everyone. I feel like I've got the graveyard shift here and I've got to go and tell my son that eating brown rice isn't any better than eating white rice, so that's going to be an interesting conversation tonight. Okay, so for those of you who don't know me, my name's Sheni Ravji-Smith. I'm the OD and leadership lead based at the Health and Social Care Partnership, and for the last 18 months I've been working on how we can better support our workforce's well-being. Obviously, it's a massive conversation at the moment. It's kind of been bubbling in the background for a very long time. We've always looked at well-being as a very reactive thing. So when somebody falls ill, we send them to occupational health. We might put some activity in place. But what we're really trying to do is trying to create some of those shifts and changes in our workplace cultures, in the way that we talk about well-being, the kinds of conversations that we have. And so there's a huge piece of work that is underway at the moment, and I'm really pleased to be here with you this afternoon to share not only some of that journey, but also some of the really practical tools and tips that have been developed for you guys as a workforce, so you can then pick whatever is relevant to you and embed it into your workday practice on a day-to-day basis. So I'm going to start my watch. I'm going to try and keep to time. You'll be pleased to know. Okay, so who's seen this blob tree before? Couple of you. Okay. I love this blob tree. So this has been developed by Pip Wilson. It was in the 70s, so it's not a new thing at all. You can download these for free, and you will get all of these slides, and everything that I talk about is all hyperlinked. So if you go through it, you'll be able to click on it, and it directly takes you to the resource. So this blob tree, I think, is brilliant, because if you look at it, what I'd encourage you all to do is think about where are you on that tree on a day-to-day basis. So I know, for example, those days that my IT's not working and the server's kind of crashing every single time, and I just can't think of any other solution. I'm that number 5 blob right at the bottom. I've given up, haven't got any energy, can't get any work done, etc., etc. And other days, I'm a little bit further up that tree. So I might be number 10, kind of quite happy in the middle. Very rarely number 20 at the moment, if I'm being dead honest. But I might be, I can't read it now, it's number 15. So hanging on, but feeling like I'm on top of things. So the reason why this is really important, I think, is because on a day-to-day basis, our mood, how we feel about ourselves, the challenges that we've got, the things that are going on at home that we might carry into the workplace, the pressures, the tensions, everything that goes on in the workplace itself, changes how you might feel on that day-to-day basis. And it's really important that we're aware of how you're feeling. And I'll talk a little bit about that in a minute. But the other reason I think this is really good is because I use this with my teams. So when I start a conversation with somebody, the first question I always ask them is, how are you doing today? And we all know the campaign, how are you? And then you ask twice, you say, how are you? You might get a different response the second time round. Or more often than not, you get a pause, and that pause doesn't necessarily mean that they're okay. It just means that perhaps you just give them a little bit of space to then talk about what might be bugging them. Because we're hardwired to go, yeah, of course I'm fine. And especially the kinds of work that we do, with a health and care workforce, we're here to look after others. It's embedded in who we are. It's our purpose and our driver. So of course we put other people first. So if you take that, then the other way around, we actually always say, yeah, I'm fine. I'm not as bad as other people. You might not say that. I'm not as bad as other people. But I'll put other people before I do. So really important, have a look at Pip Wilson, use it. I use it in all my line management conversations, all sorts of different things, really useful. So when we first started talking about well-being, we looked at all the work that was going on out there, because there is a huge amount of work. And for anyone who's looked into this, it was a little bit overwhelming at one point. There was a bit of a tsunami of get support from here, do this, do that, implement this. It felt a little bit too much and overwhelming. So we wanted to keep this resource, and it's called the Greater Manchester Wellbeing Toolkit, so hopefully you've had a chance to have a look. If you haven't, there's a link right at the bottom of that page when you get the slides. We wanted to keep this as accessible, as useful and as relevant as possible. So for us, our definition of wellbeing is helping you to be your best. That's it, simple as that, both at work and at home. And again, I was talking about cultures and legacies that we have and the way that we've inherited a lot of things. We keep work and home very, very separate historically. But actually, we're not in that space anymore. because whatever's going on in the workplace is impacted on whatever's going on at home. So I have 2 teenage sons. I talk about my teenage sons, I never name them, and they'd be horrified if they knew how much I talked about them in public, to be honest. But I've got 2 teenage sons, and with them, they have lots of challenges. Not being able to go to school, what's going on in their sports, blah, blah, blah. The hecticness of our family life has an impact on how I feel at work on a day-to-day basis. Some days I feel like I've already done a whole day even before I've opened my laptop. And I can see a few nods, so I know that some people are recognising that. So we have to treat and support and enable the whole person to be their best. It's not enough to go, I'm only going to talk to you about this bit, about work. It doesn't matter what's going on at home. Really important. The other really important thing that we defined very early on about well-being is it's not a one thing. Well-being isn't one aspect of what we are. We think it's about the practical things that help us. So that might be having good bike schemes, making sure we've got good food around us, being able to park our car, making sure that we're all remunerated properly for the work that we do. Really practical stuff. We think it's physical things as well. So, sorry, I can't remember the previous chapter name. David, Dr. Ulwin, was talking about physical activity. Really important. And in Greater Manchester, we're really lucky. We've got Greater Sport and GM Moving. And if you haven't looked at their stuff, it is brilliant. They've just launched a new strategy this week. It's worth having a look at it. And it all talks about how we can, A, support the people around us to have better well-being approaches. Really simple things, the daily mile. How to get off at a bus stop one stop earlier and do that little bit of a walk. They've got walking pathways. You'll see cycle schemes popping up. We've got new, Brompton bike things turning up all over the city centre. So pay attention to that because you can hire a bike for nothing, pretty much. Have a look at their work. It's absolutely fantastic. And then the third aspect of that, so we've got the practical, we've got the physical, we've also got the psychological. Our mental well-being. And I don't talk about mental illness, I talk about mental well-being. And in fact, I heard somebody describe it, it's not even mental well-being, it's about the mood that I'm in. So if you imagine we've got a spectrum of 0 to 10, and 10 is somebody's feeling super, super great all the time. I kind of want to bottle that up and sell it, quite frankly, because we could all do with a bit of that, a bit of sunshine. And then 0 is actually when it gets really dire. When somebody's got suicide ideation going on, when somebody's feeling that there are no other options. The majority of us will fluctuate in the middle. We'll have a good day, we'll have a bad day. And actually that's determined by lots of internal and external factors. So we need to pay attention to what's going on with us, because once we start getting good at that, we can then start paying attention to how we can support our teams, how we can support the people around us. Really important. So this session is called How We Look After Ourselves and Our Teams. So we can kind of do that symbiotically together. Okay. So very quickly, I don't want to keep on this because there's lots of really important stuff coming through. We know that COVID, the last 18 months, has told us how urgent it is to pay attention to workforce wellbeing. I've been working in this area for a long time, and I've never seen, it's unprecedented, the amount of attention it's getting. But what history also tells me is as much attention as we're getting now, it will disappear off at some point because there'll be something else that's more important on the national agenda. So what we're trying to do in Greater Manchester is make sure that we can embed it in all the work that we're doing so we can carry it forward, because guess what? It's really important that we look out for our workforce. We look out for each other, we look out for you. We also know that the pandemic really highlighted the fact that there is a disparity between different groups, different ages, different lifestyles, different characteristics, that health and well-being is not equal, and we need to pay attention to that. So about 15 months ago, I was based at the Nightingale Hospital, and we had a staff who didn't know what the risks were. The IPC rules were changing on a day-to-day basis, much like at all other places. But the really critical thing that happened was we had emerging data telling us that some of our staff were more at risk than others. And we were able to hopefully mitigate some of those risks. In fact, I think we did mitigate some of those risks because we were paying attention to that data, and we made sure that things weren't equal, but they were equitable. And it's really important to remember that. Everyone needs something different, and that's okay. What we also know is that society's shifting. So anyone who was talking about mental health or mental well-being 10 years ago, that was a bit of a taboo subject. We've had lots of very, very high-profile public campaigns that have shifted how we think about mental well-being, how we think about depression, how we think about suicide. There's still a huge amount of work to be done, but we need to pay attention to this and carry on with that. We also know that we've got sickness rates across our workforce that are damaging at the moment, because it's not only damaging for the individual, because they're so committed to that, to their work, that they continue until they literally can't work anymore, instead of asking for early help, early prevention help. But we also know it increases pressure on the staff that are then left behind as well. And the two key kind of sickness rate reasons, mental health and MSK across our workforce. And we've got lots and lots of data, some anecdotal because it's not accurate across the whole of health and care. So we know, for example, in our care homes, we've got some okay data, actually. Across primary care, we've got okay data, but it's not robust enough. So there will be lots of conversations about how we can improve some of that data collection, because it really helps us understand it. I'm not even going to ask whether people are feeling burnt out, whether you're fatigued, whether you're overwhelmed with things, because we all are. You'll all be having not so great sleep on a regular basis. You'll all be thinking about what's going on in the workplace, and that keeps you mentally occupied. So we need to pay attention to that, because that's not sustainable over a long period of time. And hopefully you'll all have gotten some form of break over the summer period. And if you haven't, please, please, please book it in over the next couple of months. Make sure that you get those spaces. When you do not turn your laptop on. Do not kind of check in with work just to make sure how things are going. Make sure you get that proper break for you and whoever you're on holiday with or having that break with. Is really important. We also know there's a massive journey ahead. So I sit in a lot of conversations where people are talking about recovery plans, and I'm the one person amongst many who kind of keep talking about the fact that actually we're not at the point of recovery. We're still in the middle of this. We don't know what's coming next. We think we can just about see the light at the end of the tunnel. You know, kids have gone back to school, universities, we've got a freshers' fair just across the way. We don't know what's on the horizon, so we're all kind of semi-bracing ourselves, aren't we? I know lots of people certainly are. So we need to talk about how we support and look after our people, because we're not quite at the end of this journey. And when we talk about recovery, people are talking about operational recovery, waiting times, patient expectations, blah, blah, blah. We want to have a really good conversation about people recovery as well, so that's really important. Okay, I quite like these two pictures, because guess what? A good day, if we're talking about what good looks like, a good day for me, and I've got to work this out right, on your right, over here, we've got blue seas, blue skies, clear sailing, all the containers are really kind of well stacked on there. That's the ideal, but actually the majority of us are that shipping container on the left. Feels a little bit precarious, we're kind of like going from side to side, all the containers are just about hanging on. And that's okay. What we need to do is get more comfortable talking about what that slide on the left looks like and feels like for us. Because we can all keep talking about how we're okay, but if we don't acknowledge when things aren't okay, we're not doing ourselves a good service. So, we're here to talk about how we look after ourselves and our teams. Some of this stuff is really basic, but it's a good reminder. And I would urge you to kind of, just when you get the slides, just have a little bit of a read through and figure out the thing that connects with you the most. So looking after your teams is really basic. Just be kind to each other. Be kind in your expectations. Be kind in your words. Have compassion. Show civility in the workplace. Take care of one another. Really important. Basic stuff you teach your kids. Be kind to one another. Really important. Proactively manage your stress and anxiety. So I talk a lot about people should have a wellbeing strategy. It sounds like a really big grand thing and 60 pages and all that sort of stuff. It's as simple as I'm going to go to the gym 3 times a week, I'm going to watch what I eat, I'm going to make sure that I don't turn my laptop on after a certain time. That's my strategy at the moment. And it will change because my working life will change, my expectations will change. So be very conscious about what you're putting into place to look after yourselves, and then how you can support others to do that as well. So if you're a line manager and you're having those one-to-one conversations, ask somebody, what are you doing to look after yourself? And if you're not asking it, please do. Please put it into practice. And in the toolkit itself, there are templates. There's lots and lots of resources. So you've got the toolkit. It's about, I don't know, about 60 pages long, whatever it is. And behind that, there's lots and lots of hyperlinks. So we've got templates about how to have good wellbeing conversations, how to do that in a one-to-one setting. Here's a template of some questions that you could ask. It's all based on good practice. So one of the things that we heard really early on is, I kind of want to ask people how they are, but I don't want to ask the wrong thing. So we've put some questions together that you might want to have a look at, and then you can adapt and use for yourself. So do have a look at that. Socially distance, but don't socially isolate. I'm not quite sure whether we're meant to be socially distancing at the moment or not, but I kind of maintain a comfortable distance from people. But I'm making sure that I stay connected with people as well at the same time. So whether that be actually going for a walk in a water park, or doing something over Teams or whatever it might be. Make sure that you connect with the people who energize you, who kind of give you that support and that buoyancy. Keep calm and don't always carry on. And I've mentioned this a couple of times. It's really hard when there's lots to be done to kind of go, oh, just do one more thing, I'll just do one more thing. And I'll put my hand up. I'm not a great role model when it comes to this. I'll do another half hour, and then before I know it, I've been sat there for 2 hours answering emails and things like that, and I have to remind myself not to do that. Do not carry on until it becomes a problem. If you feel like you're wobbling, ask for help, and we'll talk a little bit about that. I've got a slide around there. And keep looking up, and keep talking about the end of the tunnel. It is coming. It will be different. It's never going to be like it was before. Our services will be different. The way that we are organised will be different. But it is going to even out at some point, and we will feel that kind of even keel come. Okay, so I've talked about all the resources that are in the toolkit. These are some of them. Please have a look at them. We've got leaflets around improving your sleep. We've got how to breathe better for stress. Anyone who does yoga or Pilates, you'll know this practice really, really well. You can help manage your stress by improving how you breathe. So if you ever watch a baby breathing, they breathe from their belly, especially when they're asleep. As adults, we tend to breathe from our chest, which means that we're not really pulling that oxygen down. So practice how you breathe and make sure you're doing that deep belly breathing. And on that handout, there's a really simple exercise that you can practice on a day-to-day basis. And evidence is suggesting it takes about 4 weeks to change your practice about how you breathe. Just 10 minutes a day, that's all it is. So have a go at it. Thinking about menopause. There are lots and lots of people talking about menopause. There are even more people who are either perimenopausal or menopausal in our workplace at the moment. And it's having an impact on us all in some way, shape or form. So we're having some conversations over the next 6 months. We've got a masterclass happening next month, so if you want to join that, please come and let me know. There's lots of links around. And over the next 6 months, we're going to be having a series of discussions and conversations about how we can improve how we manage menopause in the workplace, how we improve what this looks like. And when you think about 80% of our workforce is female, and you think maybe a third of that might be of menopausal age, that's a significant amount of our workforce. So we're doing a little bit of work around that. Some people are choosing to make different choices around their work and life practices, whatever it might be. Maybe they want to go and do something somewhere else. They've discovered another driver, whatever. We've got a handout which is about how we find our drivers, our purpose, our motivations. It's based on Japanese theory called Ikigai, so if you're into that lifestyle type stuff, have a look at it. It's really great. We've distilled it down into a tool that you can actually use when you're having conversations with members of staff, especially when you're having those PDP appraisal type discussions. You can use it in that and have a conversation about what people want to do in terms of their goals or how they want to develop or what that might look like. So do have a look at that. We've got something around helping to manage anxiety. We've got some work around eating for well-being, and I'm not going to talk about that at all. But the thing that I did want to highlight, and I've put it on there as the biggest one, is the buddy guide. So we're really used to doing handovers, doing debriefs, clinical debriefs, critical handovers, whatever it might look like. We do not talk about how we hand over from a human perspective, how we close our working day off, how we have somebody that we can anchor into to help support us and make sure that we're all right, that we've had a break, that we've had a drink of water, where we're having a rubbish day, somebody just lends a listening ear. So the buddy guide is a really simple kind of guide to help you set up almost like a pen pal system. So it might be somebody in the same practice, somebody in your locality, in your neighbourhood that you're connected with, and you might have some commonality, so you might be in the same role in a different place. Or you might be in the same place, but have something in common, I don't know. But we know it's working because people are telling us it's working. Just having another person that you can check in with on a regular basis helps. And so for some of our primary care colleagues, they've called it the tag system, which is why I've put tag up there. That they're basically playing tag with each other. Did you have a break today? Did you see those new IPC rules? What does that look like? Oh my gosh, da, da, da. And it's just a space to be able to decompress. So have a look at that, and please do, if you put it into practice, just let me know how it goes. And all of these resources are not fixed. We're constantly evolving them and we're updating them because they're developed by feedback that we get from people like you. So if you're doing things, please let us know whether it works or it doesn't work, because it helps us really make sure that we've got those resources updated. Okay, so we've talked a little bit about stress, we've talked a little bit about anxiety, and hopefully you're all familiar with the idea and the concept of a stress bucket. So that tap at the top is the tap that's layering things on top of us on a day-to-day basis. We've got a change in our contracting, our policies, our guidance, our insurance is up for renewal, and guess what? I can't spend the 10 minutes I need to sit down at my laptop and just renew it because it just feels like that one too many things. I've missed a parents' evening, I've done this, I've done that. Day-to-day stuff that layers into that bucket. Sometimes we can't do things about that bucket, we can't do anything about that top tap because they're things out of our control. But what we can do is concentrate on that bottom tap. And that bottom tap is that well-being strategy. So what are the things that you are doing to help release that stress, to help release that anxiety? So have a think about what that might look like for you. For some people, it might be dancing, it might be listening to music, it might be chatting with family and friends, it might be spending 4 hours cooking food that you don't actually need, but then you're going to go and share it with the neighbours. There's lots and lots of different ways that people are doing these things. So have a think about what that might look like for you. Because if we're talking about being at our best, it's really important to understand how that feels for us. So going back to that blob tree right at the beginning, pay attention to how you're feeling on a day-to-day basis. And when it's a good day, think about what makes it a good day. Is it a thing? Is it the fact that you had a good night's sleep? Is it the fact that you managed to go to do some exercise in the morning and actually you've got all those endorphins still running through your body for the rest of the day? And adversely, when you don't have such a great day, think about what that might look like. You know, somebody beeped their horn at you and, you know, traffic was awful and blah, blah. Think about consciously what those factors are, because that will help you understand how to create an optimal good day for you as much as you possibly can. And when you think about that good day for yourself, think about what that might look like for somebody else. Because I know, when I'm having a good day, I'm a lot more smilier, my language is a lot more open, I'm open to suggestions, I'm a bit friendlier. I like to think I'm friendly most of the time, but I'm a bit friendlier. And I'm having a bad day, I become a little bit reductive in my language. I don't smile as much. I'm a little bit sharper perhaps in my emails. So think about how that then translates to other people. And if we think about we're all part of the same system, if one person is a little bit sharper with another and then they pass it on to another and then they pass it on to another, that's what creates our workplace cultures. So how can we start shifting some of that by putting some of the good stuff into place? Really important. And I do talk a lot about shifting cultures because we can have as many schemes and as many programs as possible, but if we're not embedding sustainable change, then we'll still be back here in 12 months' time, 24 months' time. So what we're really trying to do is look at how we can support some of those cultural shifts that we could put into place. And I don't think this is hard stuff. It's about being really clear and simple about what you're trying to achieve. It's about sharing what you're trying to achieve. What are your goals? So whether that be for you as an individual or whether that be for you within your workplace, your practice, or perhaps you at home as well. So have a think about that. Consider those 3 aspects of what good well-being looks like. So the physical, the practical, and the psychological. Because there'll be different things in those 3 columns. And anyone who's a list maker, just start making some lists and put things on there and then use that as part of your conversations. And then think about how that might support the most people that you can support. You're not going to get everything right for everyone, but hopefully if you've got lots of different things in place, there'll be something for everyone. Because there isn't a one-size-fits-all with any of this, so do think about kind of how you can be as inclusive as possible. And of course, a critical part of this is our leadership, our managers, the conversations that they have with us. So we've also done a little bit of work on how to have good conversations if you're a manager. So if you're a line manager, sometimes it can be a bit tough. You kind of get squeezed from the top, squeezed from the bottom. So we've put a guide in place, so have a look at that guide. I think I've included some of the practical things that people might want to think about. So whether you're having your weekly one-to-ones, whether you're having a quarterly kind of conversation, whether you're having your annual appraisal review, whatever system and structure you use, we've put some kind of support around that and included wellbeing as a core part of that. So if you're a manager, have a look at this. Might be helpful. I talked about some of the tools that we've got. The check-in, check-out tool is a really important one. It's that day-to-day debrief that I was talking about earlier on. And I want to draw your attention to the last bit of it because it's really important, I think. Choose an act that signifies the end of your working day. Because if you don't, your mind's going to carry on worrying. If we think about those three aspects, we still might not physically be at work, get my English right, but actually psychologically we'll still be thinking about it. We'll still be thinking about what we've got to do tomorrow or the things we didn't get done today. Figure out how you can psychologically shut down. So for some people that might be slamming a locker door. Others it might be getting on the bike or getting in your car, playing a particular track of music. I know somebody who's been working remotely and they actually did like a fake commute because they really missed their commute because it was a way that they decompressed when they went home to go and pick their kids up. So they came out of their house, walked around the block, came home, and then they were ready for kind of fish fingers or whatever it might be, and tea. So think about what that might look like, really important. And not only will it be better for you, it'll be better for your families, your flatmates, the people around you, because they'll be the first ones to notice when you're not present. And we talk about kind of, being present and mindful. And actually that's that thing about we might be here physically, but our minds might be elsewhere. So pay attention to what that might look like. And we are seeing some early signs of the impact of all of this on people's relationships at home, which isn't great actually. We don't want this to impact on people's home lives. So as much as possible, put some of those preventative measures in place. When to ask for help, really important. If you are experiencing high levels of distress, whether you're covering it up or not, you need to ask for help. If you're not able to focus on things that you were able to focus on before without major stress, then ask for help. You might be having poor sleep. You might not be able to do the simplest of tasks. I mentioned the insurance renewal. Somebody's mentioned that. In fact, that's been mentioned to me twice. Just feels like that one thing that I can't quite do. And so my insurance has lapsed over and it's automatically renewed. I know I'm paying about 150 quid more than I needed to, but I just didn't have to think about it. But it might be a sign that you're a little bit overwhelmed and you need to ask for help. If you've increased or changed your behaviours, so this is a really interesting one. I'm going to talk about substances here. Alcohol, smoking, food, fitness. And fitness is an interesting one because surely that's good for you. But if you're doing it a lot and it starts having an impact on your joints, you're A, going to have to find a good physio, but B, also that might show that there's a bit of an imbalance going on. So you might need to ask for help. If those around you are worried about you and they're saying, do you know what, I've noticed that there's been a bit of a change in you, I'm a little bit worried, don't dismiss it, pay attention to it. You might not want to have the conversation with them there and there, but pay attention to the fact that somebody who you trust is in your close circle is flagging up that they're worried about you. And you'll know in yourself whether you're worried about yourself as well, whether you're struggling and you're keeping that frame around you because you don't want to share it with people. And I think that's really important because, unfortunately, we all know that suicide ideation is on the increase. We know that it's impacting on our colleagues. I had a conversation this morning about another incident last night across our space. It's horrible, sad stuff to be dealing with. And my first question always is, did that person have somebody around them who was supporting them? Now, luckily, last night wasn't a success for them, if that makes sense. It was a good outcome. But we have to be comfortable with having conversations about suicide at the moment because it's a reality in our worlds. And there is an amazing bit of training. It takes 20 minutes. The link's in the toolkit. You can Google it. It's called Shine a Light on Suicide. It's a 20-minute bit of training. Please, please, please encourage all of your teams to do it. We don't want anyone to get to that point, but if they do, what we don't want is people around them not know how to have that conversation or where to signpost. You don't have to resolve it, you don't have to save somebody, but what you can do is just be that stepping stone to help somebody kind of come away. If we talk about that scale, that they come away from that end of the scale a little bit more. And it's a reality of where we are at the moment. If anyone wants to have a conversation about that, please come and have a conversation with me. Okay, so we have a Greater Manchester Resilience Hub here as well. And it's really interesting because actually for some people, they quite like to keep things contained. they might want to have conversations out of the workplace. Other people are quite happy to have conversations in the workplace. So we're talking about kind of, there isn't a one-size-fits-all, everyone can find something. Our Greater Manchester Resilience Hub have been commissioned to support you. It's discreet, you don't need a referral, you can go and have a conversation with them, they will do a little bit of triaging with you, and they'll put you on the pathway to the right support, whether it's a clinical intervention or whether it's something else. Please have a conversation with them. And for those of you who are practice managers in your places, there's an email on there, just drop them a line, they will come and have a conversation with you in your practice. It's a brilliant resource and it's not used as much as it should be across our footprint. So take advantage of it. Really important. And there's a whole load of stuff that they do. What I also have done for you guys is I've pulled together some of the resources that I've been mentioning and talking about into all of these things that are underlined. They're all hyperlinks. So you don't have to kind of like search for lots of information. You can literally just go and have a quick look and click, and you find all sorts of stuff. There's things there that are guides. They'll help you have those conversations. I've of course put the toolkit in there because I talk about the toolkit a lot. But what we've also got are important things like financial well-being. And we talk about those three aspects of well-being. One of those practical aspects of well-being is our financial well-being, because there's nothing worse than being under financial pressure. So the Money Advice Service are there, they are still there, they're going to continue to be there to advise people on all sorts of things, whether you've had a drop in income in your household and you're struggling with your debts and your payments, whether you are wanting to consolidate and you don't know how to do that, whatever it might be, whether you're choosing to work less hours and you just need to figure out payment plans and all sorts of stuff, they are there as advisors, so please share that with people, because we don't know where somebody might be struggling financially, but it can create a huge amount of pressure. Some of you might be more embedded in your local communities. You also might be from faith groups. So we've been doing a lot of work with our interfaith networks, for example, and looking at the kinds of support that's available there. So you might want to tap into that. And we've also been working with the LGBT Foundation as well, because we know that there are lots and lots of health inequalities across all the different demographics that we represent and we are as a workforce as well. So this is not just about us as a workforce, but it's also about the patients that we support as well, so we can be better informed about how we can support everyone. So, final slide. I never walk into a room like this without asking something of you. So my ask of you is, please go away from today and think about what is it that you're trying to put into place consciously. How do you want to improve your workplace culture, your well-being culture, and what can you do about it? Think about the things that you've got in place already that you might not be utilising or maximising at the moment, or you might notice that there's some gaps in provision that you need. So if you've got things that you're not using, that's brilliant. You've already got stuff around you. Make sure you've got some posters around you. Make sure that everyone's got the information in your staff briefings, whatever it might be. Everyone does it in a slightly different way. If there are gaps in what you need, contact us. Because one of the things that we're doing is we're doing lots of advice, we're doing lots of signposting, we're doing lots of guidance with individual practices, with clusters, with different groupings. So come and ask us. And if we don't know the answer, then what we've become really good at is finding the resource to put some stuff into place. And that's where we are at the moment. So think about what it is that you need. Remember to share it and be as inclusive as possible with the people around you. So there's nothing worse than one person having A, the responsibility, but B, also the burden, and I use that word not so lightly, of having to look after the well-being of everyone. It's all of our responsibility. And the way to do that is to engage everyone in the conversation. Ask people, what is it do you think that would help us? What can we do? How can we shift some of this? And I'm sure you're all really good. Think about it. I'm doing some work with one practice at the moment, and we're taking a bit of a QI approach to it. So, right, where are we at the moment? What do we want to change? How are we going to know when we get there? What are the things that we've done in the meantime? And actually that works for them. That's the kind of language and frame that they like. Other people, one place that I know, are buying cups. So I'm trying not to promote Etsy, but Etsy are selling cups at the moment called Cup of Kindness. So what they're doing is they're doing a bit of a make a brew. So if they see somebody struggling, they don't want to have a conversation. What they might do is just make a cup of tea and just put it in front of someone. And for them, in their culture, that's a signifier that actually, I'm just checking in with you. If you want to have a chat with me, just come and find me. It's quite a nice thing, actually. I quite like the cup of happiness. So think about what it is that you want to change in your workplace and put some things into place. And I mentioned earlier on, it doesn't have to be big stuff. It could be small incremental actions that make a big difference for people. I think I'll leave it there. Thank you.